Welcome everyone to our very first Power to the Parents Q&A. This is a brand new series where we dive into the topics that matter most to you as parents, everything from food safety to raising healthy and happy kids. We're bringing in experts, answering your questions, and giving you the tools you need to feel empowered in your parenting journey. I'm Angela, co-founder and chief product officer of Little Spoon. And today we're kicking things off with an incredibly important topic, and it's one that we get many questions about, and that is toxins in baby food. So today we have someone really amazing joining us. Dr. Bruce Lanphear is here. And I have to say, if you've ever been overwhelmed about your baby's food or how to keep your little ones safe from all of those environmental toxins we hear about, this is the guy you want to listen to. So Dr. Bruce Lanphear is a world-renowned pediatric health expert, an environmental scientist who's been fighting for safer standards for years. His research has changed the game when it comes to protecting kids. He is on the team at the nonprofit organization Little Things Matter, aiming to spread awareness about the effects of toxic chemicals and the health of our population and planet. So today he's going to help us cut through the noise and understand what really matters when it comes to toxins and food safety. And I am so excited to have him with us. So let's get right into it. Thank you so much for being here, Bruce.
You're very welcome. Good to be here, Angela.
Nice. Okay, so first question, let's jump right in. Tell us about your background and work in early childhood health.
So I'm trained as a physician, particularly in public health. And then I had some additional training in community pediatric research. So how do we study not what happens in laboratory rats, but what happens in the community with people and with children in particular. And then I was originally planning to go into tropical medicine, but my wife, who's a developmental pediatrician, got me turned on to all of the challenges that she was seeing in kids with behavioral and developmental problems, and ultimately shifted to try to understand better what was happening to children.
Oh, that's so interesting. So why are heavy metals a concern for parents, and why is this such an emerging topic in the U.S.?
Well, it's really an old topic. I mean, lead, for example, we've known has been a toxin for several thousands of years. It might have contributed to the decline of the Roman Empire. But what happened, unfortunately, is about a century ago, they began to add lead to gasoline to get rid of the knock, to try to delay how quickly gasoline burned in the engine and produced a peak, and it reduced the efficiency. The government and the companies making tetraethyl warned that this was going to cause a scourge worse than tuberculosis with hardening of the arteries. They already knew that lead caused poisoning in children from lead paint in studies in Queensland, Australia, but there was so much profit to be made, they just couldn't help themselves. So lead has been a problem for a long time. Arsenic, we know, another heavy metal, was used to poison people in the past, and it was a problem when it leached out the green wallpaper. So we know these heavy metals have been a problem, but there was always this illusion, perhaps, that at the low level they were safe. And we now know that's not true.
We get questions about this all of the time. I do feel like in the last decade or so, though, the topic of heavy metals has really become more pervasive as it relates to baby food and kids' food. Can you talk a little bit about that and why, the rise of all of these questions around baby and kids' food as it relates to heavy metals?
Yeah. I think the key reason is, and probably lead was the first where we really recognized that there were no safe levels. And that took over a decade. Maybe that doesn't seem too long, but as a scientist who was studying this, it was frustratingly slow that it took so long for this science to get translated into regulation. And it's still being translated, but at least in 2012, our government agencies like the CDC and the EPA recognized finally that there was no safe level. And so as that recognition has occurred, we've begun to realize that what was thought to be safe, from the amount of lead in water from lead service lines or in baby foods, wasn't. And I think that's a large part of the reason for the growing recognition over the past 10 or 20 years. But there was also outbreaks like in Washington, D.C., and then in Flint, Michigan, where there were increases in the amount of contamination, either from lead service lines or children who continue to be poisoned from old paint found in their homes or soil. That is just so pervasive. I mean, it's come down. We can all be thankful that the amount of lead in human bodies has come down by over 95% in the past 4 or 5 decades. But we are still exposed to levels of lead in our body that are 10 to 100 times higher than our pre-industrial ancestors. So it's not low on an evolutionary scale.
Wow, interesting. So when you think about the journey that parents are on today, navigating concerns about toxins in food, water, the environment, and we see this at Little Spoon, we get inundated with questions every time there's an article in the news about heavy metals. What's one thing that you wish every parent knew?
Well, unfortunately, in the short term, what I want every parent to know is that our regulatory system is failing to protect us. And I don't want to scare people, but I want to let them know in the short term, they need to take steps to reduce their own exposure until we're able to demand changes of our regulatory system so that we don't have to worry about it anymore. And that's going to take a little time. That's the ultimate goal, though. I don't want parents to have to worry about this or to have to plan their diet based upon how much arsenic might be in the rice or how much lead might be in their baby food. But the reality is, at least for the near future, that does have to happen.
So one of the things that we're doing at Little Spoon is we are testing every single batch of our baby food, and we have aligned our own internal standards with the standards set forth by the European Union for heavy metals and other toxins in baby food, because there are no standards set in the United States today. So, why is it important? I'd love to hear from you. Why is it important that Little Spoon aligns with those standards?
Well, because the regulations haven't kept up. We do have regulations about how much lead should be allowed in food, but they haven't kept up with the science. And so what Little Spoon is doing by being transparent, by testing their product, is unfortunately a necessary step to make sure that our food is safe. This is really the same thing that happened about a century ago. There used to be bits of rats and poisons in food. And then there were some companies that started to say, even before regulations, we're going to make sure that the food we sell is safe. And I think we're seeing the same demand and the same intention with Little Spoon and other companies that are saying, we want to make sure that our food is safe. And we not only think it's the right thing to do, but it's a good marketing strategy.
Right. And I think, we really wanted to put the power in our hands to set forth our own internal regulations in absence of federal regulations. So we really ultimately just want to put the power in parents' hands to make the decision that they feel is best for their family and giving them the most information that we can possibly give them when it comes to feeding their kids. So what are some practical steps parents can take right now to reduce their children's exposure to heavy metals and toxins?
Well, I try to give some simple steps just because, we're all trying to just live through our lives and those are complicated enough. But there are certainly some things we can do by trying to choose organic whenever possible to try to minimize our exposure, our children's exposures to heavily processed foods and canned foods. We need to be thinking about the water we drink. Regulations for lead and many other chemicals have not kept up. And so while we've seen tremendous success in making water safe from the standpoint of infectious disease, and we've seen some reductions in lead, and the Biden administration has made big steps to try to replace the old lead service lines, we continually find new problems. Now it's the PFAS chemicals, so it's Teflon-like forever chemicals that are found in too many communities across the United States. And so many of us have started to use water filters in our home until we have more confidence that the water authorities are keeping up. And this is really quite sad to see that our public health system hasn't kept up with these regulations around chemicals. They've done a good job with infectious diseases in most places, but not the chemicals. And that's something that I think is going to have to be pushed forth, demanded by parents and the public, unfortunately.
Definitely. And I really feel like these topics have only become more pervasive. So hopefully in the next decade or two, we will at least see some regulatory change happening there. What do you think are some of the most common misconceptions when it comes to toxic heavy metals in food? And how can parents shift from a place of fear to empowerment? I think there's a lot of misinformation out there. If you scroll through social media, if you're, Googling around on the internet, you hear different things from different places. There are a lot of alarmist things, sensationalized things. What do you think are the most common misconceptions when it comes to toxins and heavy metals in food?
Well, I think one of them is if you can buy it on the store shelf, then you can trust that it's safe. And that's not necessarily true. We've set up a system where parents do need to take extra steps to be sure, to be confident that the food they eat is safe. I do think, there are some things we can take comfort in. For example, the amount of exposure we've had to lead has come down dramatically. The exposure we've had to some other metals, arsenic, for example, has come down over the years. So we can take comfort in that. And the question is it low enough? We can also take comfort in that, as a rule, we're quite resilient to things in our environment, to different types of stressors. So even though we can see harms at these low levels, we are resilient. And yet we continue to find new studies. For example, a study that we finished last year in a Canadian birth cohort, over 2,000 women that were followed, and we found that extraordinarily small increases in lead, middle class population, was associated with about a 50% increase in preterm birth. Among women who had small increases in lead and were vitamin D deficient, we saw threefold increases. So we're still seeing these impacts at very low levels. Now, what happens typically when there's a recognition of things like children being born too small? We build bigger NICUs, we build more hospitals, but we have another option. And this is, I think, perhaps one of the most important things for parents to know. Many of the diseases, many of the disorders that we experience, that our children experience, are man-made. Now, that means that we can change it. So there are opportunities for us to prevent disease. And yet our medical system, our healthcare system, which is called the healthcare system, but it really is a medical system, is almost focused entirely on treating disease, on finding new drugs. And at the same time, it's ignoring how environmental influences, including these toxic chemicals, can harm us in the first place. And it's not giving us that as an option to prevent disease and disorders.
What gives you hope when you think about the future of food safety and transparency? What should parents out there feel hopeful about that are maybe feeling a little stressed and overwhelmed when it comes to decisions around feeding their kids?
Well, a couple of things. One is we are making progress. We have made some progress. I mean, even as we failed to learn some of the key lessons, we've made progress. That's the first thing. Second is that there are things that parents can do in the short term by choosing what type of food to buy or make in their homes. So there are some things that families can do today. We don't have to wait for the regulatory systems to be put in place. And yet we do have to recognize that this is a big burden on families to try to figure out what food is safe. That's not something we should have to do today, particularly when there's so much known about how these chemicals in our food can cause harm. So there is some good news, but the bad news is we're going to need parents to help us in this fight to try to make food even safer, even as they're trying to protect their family today.
Definitely. I agree. It's a journey, whatever little steps you can take. And that's why we are, testing each batch of our food and showing those results to parents so they can at least have a little bit of peace of mind when it comes to when they're feeding their kid if it's coming from Little Spoon. So last question here, if you could sit in a room full of parents with infants who are anxious and unsure about how to protect their children from toxins, what would you say to them?
Well, first I'd try to walk through some steps that they can take today. When possible, choose organic. If you can know the farmer who produced it, that's great. Cooking at home. It's an opportunity for the family to sit together, to cook, to talk. And so those are things that actually can bring a lot of quality of life. It's not just a burden. It can actually be quite enriching. And then I think finally to recognize that the kind of food we eat, the kind of farms that we support can have a big impact not only on our health, on the soil health, but also on climate change. And so we need to be much more thoughtful about the food we eat, the farms we support, because those are really fundamental to a healthy life and a healthy planet.
Yeah, I think that's something really interesting that a lot of people maybe don't really think about because you think about soil quality and where the food's being grown, but not necessarily climate change and the larger things that are happening that really make the soil what it is that the food is being grown in. So I think that's a really interesting point. We work with some really wonderful partner farms at Little Spoon. All of the produce that we use is certified USA organic in our baby blends line, and we visited a lot of those farms, mostly in Oregon and California, and it's just really wonderful to see the farming practices that they're employing. And we hold ourselves to really strict standards, so parents can be rest assured the ingredients that we are sourcing that are going into our food is top quality. So that was amazing. Thank you to Dr. Bruce Lanphear for bringing here and sharing all of his incredible knowledge with us. It could really be so overwhelming for parents to talk about this topic. You've really helped break it down for us today and empower us to bring change. And we're really grateful for your work in the community and our Little Spoon efforts. Our Power to the Parents Q&A series has so much more in store. These are the conversations that parents and experts should be having. Tell us who you want us to talk to next, what questions you have for our experts, and how we can bring the information that matters to you most. Until next time.